All right, we are recording. This is January 13th, 2021, the Beaufort Regional Chamber of Commerce webinar call on vaccine distribution. We're really happy to be joined by Russell Baxley, CEO, and Kurt Gambla, Chief Medical Officer from Beaufort Memorial Hospital. Russell, the floor is yours. We're all ears about vaccine distribution for COVID-19, where we're at and where we're headed.
Absolutely, Ian. Can you hear me?
Yes, sir.
All right. First, Ian, appreciate you putting this together on short notice. And appreciate everyone's attendance to this on short notice. As you guys can imagine, this is moving quickly. It's fast and it's furious, and there's a lot of interest in the vaccine, which is good. That makes myself as a hospital administrator, I know Kurt Gambla, our chief medical officer, and all those at the hospital excited to see all of the interest in this vaccine, because it does make us feel like there's a light at the end of the tunnel. We've all, as a community, been going through the COVID pandemic for the better part of a year now, and this really feels like a step in the right direction. Unfortunately, however, this step in the right direction it feels like small steps as we try to secure more and more vaccine to really meet the demand. And so what I would like to say is that my presentation today is really going to focus on what our processes are, as each hospital's process is different. And so I want the community here to know what is Beaufort Memorial's process, how are we troubleshooting and addressing any issues and concerns from the community, and what do we see going forward through this pandemic as more vaccine becomes available. So obviously there'll be time for questions at the end. I know Ian again is going to moderate and look at the chat bucket, so we will try to address each of your questions as we can. So let me first start by, very early on when Beaufort Memorial knew we were going to get vaccines, we did purchase a ultra cold freezer in order to secure more Pfizer vaccine in the initial start to this vaccination plan than in order to vaccinate more in the beginning, because we knew from the very beginning that phase 1A was going to be not only our employees, but other frontline healthcare workers such as first responders, physician clinics, dental offices, and that list has grown each day as 1A has expanded more and more. And so when we got the walk-in, the ultra cold freezer, we then ordered directly from Pfizer. And so typically what we do is we order about 975 to 1,000 vaccines a week in order to keep up with demand in phase 1A. We do have the ability to order more so long as supplies last. But that's what we did in the very beginning, is say, hey, we need to be able to store this now and in the future as this opens up to the general public. We have been and are currently vaccinating in 1A still. That was a big group. And as I said, that group grew bigger each day as the state added funeral homes to that, correctional officers to it. It added dental offices at a later date. Dental offices weren't first included in phase 1A and then were, which is great and appropriate. And so we got what I would say is a lot of interest very early on, and did our best to try and meet that need. Whereas right now, I can tell you, still through phase 1A, as we start the 70 plus today, which was added to 1A, and subsequently we know 1B is opening up. We had vaccinated, as of yesterday at lunch, 1,517 people, and we had 14 scheduled to be vaccinated. That basically 3,000 people accounted for all of our vaccine inventory. And so that's what we've been very cognizant of doing, is focusing on those frontline healthcare workers, those that are in phase 1A, specifically people who are hands-on with patient care, because we knew our vaccine allotment was limited, as is the state. The state has 4.5 million people. The state did not get 4.5 million vaccines. And as such, we've had to figure out a way to, how do we prioritize, how do we triage who we're vaccinating first, and then continue to work our way through the process as we're able to secure more vaccine. Luckily, we have put in another order for more Pfizer vaccine. We think we're going to get another 2,000 doses in. So even though we have the current allotment spoken for of the 3,000 doses that we have on hand or have already vaccinated, we're getting another 2,000 doses in, and we will continue to order each week as we build out the schedule. And so we haven't been perfect in this, in the way that we've handled it, but I think we've done a really good job trying to meet the high demand with limited resources, because as you guys are aware, COVID-19 has surged after the holiday season, and so we have been dealing with a higher than normal census prior to Thanksgiving and Christmas. We have been dealing with a higher than normal census of COVID-19 patients, of community testing. The percent positive rate has hovered between 20 and 30% over the last 4 to 6 weeks for Beaufort Memorial. And so we've been trying to attack this two-headed monster really as best we can, to serve both those that are suffering from and actively sick with COVID-19, and also those who want to prevent getting COVID-19. So it's really been an exercise in disaster planning for sure for the hospital and the system, as dividing our resources to really wage battle on both fronts against the COVID-19 pandemic.
Back. I'll call you back. Okay. Okay. Thanks.
In terms of what we're doing now to meet the need of the 70 plus, and that need is great. I can tell you that, one thing we did in the beginning is we looked at our electronic medical records for our physician practices. And we just said, what is the count of patients that are 70 plus that see our physicians? That number was close to 20,000. So obviously at 20,000 70 plus year olds, plus all the first responders we were still working towards, as I mentioned, we don't have 20,000 vaccines. And so we are working through that. What we did when the governor made that announcement, we did 3 things. We put together a call center with a new COVID hotline. That call center has 6 operators working 8 to 5. And I can tell you on Tuesday morning, because the announcement was made Monday, on Tuesday morning at 8 o'clock, I was in the call center. When that clock struck 8, every line lit up like a Christmas tree. And the phones have not stopped ringing since yesterday at 8 o'clock in the morning in that call center. We put together an email where you could email your information to us, and then we would help you to schedule an appointment. That email is vaccine@bmhsc.org. Between emails and voicemails over the last day and a half, I can tell you we have 10,000 emails and voicemails already of people interested in getting the vaccine, scheduling an appointment, trying to get through to say, how do I get a vaccine at one of your 2 locations? And then the third thing that we did is for about 12,000 of the 70 plus patients that were in our medical records, we took, and again, this is a triaging type process. We tried to get to any patient that has seen one of our Beaufort Memorial physicians in the last year and proactively sent them a couple of messages letting them know that we will be using their email addresses on file, their patient portal, and other opportunities, since we had their information, to proactively send them links to schedule their appointments. Now, let me talk about how you schedule the appointment, because that is something that's been, I think, confusing, but is being driven at a federal level, and each hospital is doing it a little bit differently. Ultimately, where everyone has to get scheduled is into the VAMS website. It's the Vaccine Administration website, which was put together early on in this pandemic through the federal government in order to schedule 1A healthcare workers and subsequently the general population, 1B and everybody else, because what it does is it shows vaccine locations, not just Beaufort Memorial, but everyone's vaccine locations. And it also marries up appointments, as well as it tries to do its best to marry up inventory to help everyone stay on the same page as people are going to multiple sites. Multiple sites are getting different vaccines, as we're all aware. We have the Pfizer vaccine, but next week when pharmacies hopefully come online, they'll have the Moderna vaccine. And if you get the Pfizer vaccine, you cannot then get a second dose of the Moderna vaccine. You have to get the Pfizer, right? So both Moderna and Pfizer require 2 doses. Moderna, I think, is around 28 days from the first dose. Pfizer, we know, is 21 days from the first dose, and you can fall about 3 days on either side of that. So that's really 17 to 24 days in which you can schedule that second dose. But logistics is key in scheduling patients, because if you get the Pfizer the first time, you have to get the Pfizer the second time, and subsequently you have to get the Pfizer the second time within that 17 to 24 day window, right? And the VAMS system is helpful in that, because when you schedule your first appointment at VAMS, after you get the vaccine, you can schedule the second appointment at VAMS, and that VAMS system works with you to send you appointment reminders, and also can print off vaccine certifications when you get your second dose. It really is kind of the hub that we're trying to work within to keep all things organized, which is why we're trying to leverage the VAMS system. So if you were a patient of Beaufort Memorial, hopefully you got, and we had all your information on file and a correct email address. Hopefully last night, if you're 70 plus, you got an email from us stating this is the process that you will need to follow, and then subsequently a second email from the CDC asking you to schedule in the VAM system. If you were not a patient, or for some reason we didn't have your email address or the correct email address on file, that's why we put up that dedicated number that you can find on the Beaufort Memorial website and or that dedicated email. And then we have a team of people working through those emails, those phone calls, those voicemails, that if you leave us your information, we will then insert you into the VAM system and you will receive that email within 24 hours to 48 hours of you contacting us. That is our goal. And or we will call you back if we can't understand the email, we don't have all the information, we can't understand the voicemail, we will call you back and make sure we have the right information so as we can upload you into the VAM system. That has been the most effective way for us as an organization to work through this. And I can tell you that it hasn't worked every time, and we've had some troubleshooting issues. We've walked some people and some patients through, but for the most part, it's been working, and a lot of people are scheduling appointments. And those who can't, we're getting to them one by one to get them scheduled and get them into the system. So we are meticulously and strategically kind of working through this process so as to get to everybody. But patience is going to be key because, as I said earlier, within a day and a half, we had 10,000 emails and voicemails that we had to work through and that we are working through in order to get to all the concerned citizens that are out there. We are opening up more appointment slots at both our locations, Beaufort and Okatee. Okatee is our new facility at 122 Okatee Center Boulevard, Suite 100. They are able to vaccinate interested citizens and patients there. And obviously here in Beaufort, it's at 989 Rebo Road, Suite 300. And it's confusing in VAMS because it lists the hospital as the vaccination site. What I will tell you is that that is listed in VAMS that way because that is where we had to list in terms of where we would be receiving vaccines. But the clinic where you would get the vaccine is actually at our medical office building next door in the 3rd floor in Suite 300. And that is where we're currently vaccinating people. And at that site, we can probably vaccinate between 150 and 200 a day with ease. And at Okatee right now, we're at about 50, but we're opening that up in the next week to get up to about that same mark, where we hope by the end of next week, we can vaccinate around 400 people a day if those clinic schedules are full. We want to do more and we hope to do more. But as I stated before, we are waging battle on 2 fronts and just trying to allocate resources appropriately. The goal is, and the hope is that as this opens up more and more to the rest of the community, that other vaccination centers will come online, like pharmacies, for example. I know Publix will be coming online next week. We have a good relationship with Publix already. Beaufort Memorial does with our telemedicine clinics in their grocery stores. And they will be receiving Moderna vaccine and will be starting the process of vaccination next week. So, we hope that Beaufort Memorial is not the only vaccine site. We obviously cannot cover the waterfront. We just don't have the capacity or the resources, which is why we need Publix. Beaufort Jasper Comp Health is going to be a vaccination site, why we need them to come online as well. And they're working hard on that. As they come online, there will be more points of access for the community to get the vaccine. And that will help, I think, with the demand because it is high. And we are just working through it. A couple of best practices, when working in the VAM system, because we're getting a lot of emails for, I'll say, spouses that share an email address. I think specifically one thing we learned is that you each have to have your own unique email address to register in VAMS to set up 2 different appointments. If you have one email address, you can set up one appointment. It will not allow you, for example, to set up an appointment at Beaufort Memorial and subsequently, in case you're thinking, well, maybe I want to just hedge my bets to make sure I get the vaccine, so I'll set up another appointment at Doctor's Care. It will not let you set up 2 appointments. So one email address, one appointment within VAMS in order to make sure that, the appointments are not booked up and triple booked by the same person so as to make sure everyone's getting an opportunity to get vaccinated. So one of the best practices we're telling people in troubleshooting is if you only have one email address that you share, do your best to create another free email with Gmail or Yahoo, and that will allow you to register your spouse. In terms of other opportunities, we are at the Beaufort Memorial website because VAMs can sometimes, for some, be difficult to navigate. Hopefully by the end of the day today, we will be having screenshots for the community. And those screenshots will take you step by step as to how to register in VAMs and what button to click on, and some FAQs or some troubleshooting points on each screen that says, this is normally what happens. This is where you need to scroll. This is the button you need to click. If you can't find Beaufort Memorial, use this zip code and refresh your screen, because the website is obviously seeing a lot of high traffic. And every once in a while it has a glitch, and we just have to work through those glitches sometimes. So we are working very hard to put kind of a how-to on our website where it takes you step by screenshot of how to work through the VAM system. If at the end of the day you can't work through the VAM system, we do have the hotline. We will get you scheduled in a different way. VAMs is not the only way we can get you in, but it is the most efficient and cleanest way to get you in. But we are working with people that for whatever reason can't work through the VAM system. We are scheduling them as well through other pathways and opportunities. So, we're doing our best to accommodate all people that that are trying to get vaccinated at this time. The other thing I would say is that we are allowing our schedule to go out all the way through March. If we allow our schedule to go all the way out through March, that would probably end up being thousands, 5,000 to 6,000 to 7,000 appointments that people could book. Obviously, we don't have 5,000 to 6,000 vaccines in-house, but we have and will continue to order each week to meet the demand of each week, and then hopefully the next week. If for some reason we do run out of vaccine and we have appointments, our goal would be to cancel those appointments and work with each patient to reschedule in the order that they were scheduled in order to get them vaccinated when we get more inventory in. So what I would say is everyone, as you're in the community, as you guys are communicating in the community, our goal is to continue to schedule patients as quickly and as far out as we can, with the idea that the vaccine will continue to come in. If it does not, we will let everybody know. We will get you rescheduled as quickly as we can as we get more vaccine in. And we will continue to get the Pfizer vaccine because that's what we started with. We have the ability to store it. And so that's what we want to continue with as we press forward. So I would just say again, if 3-4 weeks from now, if you are one of those or someone has scheduled an appointment and it gets canceled by Beaufort Memorial, it's most likely, we will put this in the email, just because we have exceeded our inventory and are waiting on more to come. And so we will just try to get everyone rescheduled. It is definitely not a perfect system, but I think that every day we get a little bit better at it. And we've got a lot of very good people working very hard, really outside of their jobs. The one thing I'm proud of this organization would say, there's not one person at this point in time who has said that is not my job. And we've got people from every department working phones, making return phone calls, answering emails that have to do with the vaccine. There's not a single person who has not stepped up from any part of this organization that has time to lend an hour here, 3 hours there, a day here, who isn't trying to help get us through this process. And I just want to commend the entire organization and medical staff for really just continuing to put their heads down and fighting through this, and just proud of this organization. So Ian, I'm going to pause there because again, that's really our process. We don't know when 1B is going to be called. We believe 1B is going to be called after January 15th at some point in time. Obviously, that could change, and we get our instructions from the state. So what I would say is we don't. This is my last point. We don't pick and choose who gets the vaccine and who doesn't. We get our directives from DHEC. We're following the state website, much like everybody else is. If you're going to the DHEC website and you're going to COVID-19, hitting that vaccine link, we're following that as much as anybody else is. And transparently, we learn about who's going to be in the next phase. I would just say an hour or two before the general public learns at this point in time. We sometimes learn when you learn. when the announcement is made, unfortunately. And that's how fast things are moving in the state. And so when we see those announcements again, and people start calling, and we've gotten a little frustration with that, is not because we don't want to help you. It's mostly because we either just learned about it with you in terms of the change, and or we learned about it an hour ago, and we're trying to huddle as best we can to fix and change our processes to accommodate, I would say, more patients, more people interested in the vaccine. Just trying to say, all right, how do we grow this? How do we change it? How do we expand it? How do we pivot a little bit to meet the needs of the community? And so I would say, again, just be patient with us as you're calling, as you're entering the vaccine clinics. We will get to everybody as quickly as we can.
Russell, thank you so much for the briefing. I sincerely appreciate your transparency. I know it's of value to everybody from the community and the chamber membership who's on the call today. And I also really sincerely express the chamber's thanks to your team, who I know have been sprinting for months now and adding a significant amount of responsibility onto an already difficult job. The good news is the light's at the end of the tunnel here. And I'm encouraged by the number of folks who are interested and who are on this call. You know, one of the questions that kind of permeating in the community is the vaccine safe? Again, I think I'm encouraged by the number of folks on the call who I assume are all ready to get it. I certainly am. As soon as they decide baldness is a condition that's pre-existing, maybe I'll get in earlier. But as soon as it opens up, I'll be first in line when I'm allowed. For anybody who's still hesitant, or anybody who has a person in their family who may be hesitant, what words of reassurance might you, or maybe this could also go to Dr. Gambla, who I know is on the line, how would you advise us to help encourage folks in our lives who are a little hesitant about this vaccine?
Yeah, absolutely. I am going to punt this to Dr. Kirk Gambla. He and Dr. Luke Baxley have done a great job, I think, helping to educate our staff first on the safety of the vaccine, as well as, I know, first responders and others in the community. So I'm going to let Kurt run with this one.
Hey, good afternoon, everybody. Can you hear me okay?
Yes, we can hear you fine.
Great. Well, thanks for the opportunity. Yeah, you know, I think that between some of the misinformation that's out there, you're always going to have a fringe group of people that are going to try to sound the panic alarm. Between that and just the fact that the way that we came upon this vaccine it's just unprecedented in the history of medicine, really. So normally, you know, from concept to delivery of a vaccine, you know, typically that's anywhere from 3 years to 10 years, so decades. So to come to delivery of this thing in 9 months, less than 9 months, less than the amount of time it takes to have a baby it's extraordinary. And I think that has maybe caused a few people to take pause. But the thing that we have to remember about how this thing got developed was there was also just an unprecedented amount of resources, dollars, talent, brain power that really got focused on this thing that was never the case in the past. And so probably about 70, 80,000 people in the study groups before this thing ever went before the EUA, before the FDA to get approved. And the side effects, the serious side effects, the adverse reactions, extraordinarily low. So, you know, originally when they were designing this, they were hoping for a vaccine that would be about 50% effective, so 95% effective. It just, you know, they hit it out of the park. And again, in terms of the side effects that they recognized during the development of this, and again, now that we've had, you know, I think in the United States about 8 million vaccines administered, the post-marketing, I'll call it, experience has been the same. It's been extraordinarily low in terms of the side effects that people have had, other than what you would normally expect from, for instance, a flu vaccine, which is, you know, a little mild muscle ache in some people, maybe a little fever, a little headache. All of those things very self-limiting, gone within about 48 to 72 hours, and actually a good sign. So if you get some of those, that means that your immune system is responding the way we expect it to. So, you know, we're continuing to try and make sure that we're waging the PR campaign, not because this is propaganda, but it's the truth, is that this is an extraordinarily safe, extraordinarily effective vaccine. And we're I think, very encouraged by, it's a good problem to have that our phones are ringing off the hook, as opposed to people saying, yeah, I don't think I want to get it, or I'm going to sit back. So remember, the magic number before we can say that the vaccine is getting us anywhere close to herd immunity, meaning we can sort of let our guard down, that number between the number of people that have been vaccinated or got the infection and recovered from it, that total number needs to be about 70% of the population. You know, right now that's sitting at about 2 or 3%. So while we're on the right track and this vaccine is going to help us, you know, what we're also trying to really remind people of is just because you've had the vaccination does not mean let down your guard. 95% is not 100%, so we're still encouraging people to wear their mask, practice social distancing. And the other thing to remember is, even though the vaccine may make you immune, what was studied as the endpoints in the research on this vaccine was who's going to get sick after they get the vaccine. And so while it may protect you from becoming sick, we still don't know what your viral burden is, meaning that the vaccine can keep you from getting sick, but you may walk around and be exposed and be shedding virus and still be able to expose other people. So one important take home that we're trying to really emphasize to people is that this is another layer, another weapon in our arsenal, but this is not a substitute for, at this point in time, the masking, the social distancing, the avoiding large gatherings, et cetera. It's an add-on.
Dr. Gambla, thank you for that. You know, a Chamber of Commerce crowd will often bristle at the idea of regulations getting in the way of progress. I think this is a great example of flexibility and pace with focus of energy, doing a simultaneous process. We were able to get, the country was able to get this vaccine through in incredible speed, going through the right processes. I for one, am delighted at the progress, and I certainly believe this is the ticket to getting our economy back on track fully, which is certainly a top priority for us here at the Beaufort Regional Chamber. I thank you both for the briefing. We do have some questions, and I'll again invite anybody who has a question for either Russell or Kurt to please submit those via chat, and I'll moderate those. But one really important one that is worth getting up right up front, for folks younger than 70, 70 is the current age for DHEC that we've just opened up. For people younger than 70 that may have a compromising health condition or a pre-existing health condition that compromises their immune system, for example, diabetes or heart disease, what's the process for them? Is it open? If not, when might that happen?
Well, if you go strictly by the DHEC website, which is what we've tried to do, take our directives from DHEC, because I think that gives us the most fair and consistent way to distribute and vaccinate our population. It looks to be, and again, this updates and I think changes daily based on what is going on with the state, probably also based on how many vaccine clinics they have up and running, and also how much supply we're able to secure for the state. It looks like right now that would be a phase 1C person, meaning that anyone with an underlying health condition, it looks like 16 to 64, would be in phase 1C, and or all people aged 65 to 74 years old would also be in that 1C. But again, 1B was 75 and older previously, and that's been moved up to 1A. So it may be that 65 and older, and if you follow what the CDC just recommended, which is everyone 65 and older should get a shot, which is true. 65 and older or underlying health conditions could be moved up in the state as well. So But I would say I have no understanding at this point when that group, for example, would be put into what phase. I only, like I said, go by what we get from the state, which is updated regularly. And, hopefully that those underlying health conditions, the 65 and over, are moved up. We want to get to everyone as quickly as possible. And as soon as we know something, we will let the community know something, or like I said, you may know it at the same time we know it. And we'll react as you guys react.
All right, so for now, we're at that 70 and older group, and we'll all stay tuned and also keep our eyes out on both DHEC and Beaufort Memorial's websites for additional info. A question came in right at the beginning of our session. Have you heard any discussion at all about veterinary health professionals, either hospitals or clinics, veterinary staff, in any of the prior conversations about DHEC, from DHEC in the eligibility groups?
I have not. I've actually heard that come up a couple of times, but I have not heard any direction from DHEC for that group. What I would say is that what I have seen is when groups have felt as if they should have been included in a certain phase, and a lot who were added to 1A later on, the way I believe they were added is there was a lot of advocacy at the state from a larger coalition, of that group to the state. And so for the veterinarians and the clinics, what I would say is I have not heard anything. What I have heard is that there is concern. Why are we not included? I would continue to contact your senators, the state, and advocate for those groups, because I think that is how other groups have gotten on from what I've seen, how that list has grown. But unfortunately, I don't have more than that in terms of that grouping.
Thank you, Russell. A really smart compound question from Nicole Bentley at Apprenticeship Carolina. And I might actually kind of ask in two parts. One, we are expecting a presidential administration changeover to happen next week. Do you or anybody that you've talked with anticipate any significant changes as a result of a administration change?
Well, if you listen to what President-elect Biden is saying, he wants to release all the vaccine now versus what I think is the strategy of the current administration of releasing some and holding back second doses in anticipation that you'll need those for the second dose. I don't know if they believe that at this point, they would not be able to keep up demand and supply, and some would miss their second dose. So if the new administration takes that approach and says we want to distribute all vaccine now, I would believe that they would then distribute that to the states, and I would expect supply to go up. And then subsequently, what we would have to watch for is making sure that, as supply went up and hospitals, pharmacies, physician clinics got more and more supply, that supply kept coming in, so we could make sure we met the demand of that second dose. Because as Kurt, I think, stated, or maybe he didn't, the first dose, you're 50% immune. It's that second dose where you gain that 95% immunity. Now, some countries have taken the whole, the approach, or there's a study out there. Maybe we just give the one dose of Moderna and vaccinate as many as we can. I've heard a lot of talk of that, but I have not seen where that's been implemented or close to being implemented in the states. As Kurt stated, this was brought to market very quickly, and we are continuing to learn as the public learns as what is the effectiveness and the opportunities as we vaccinate more people to do things a little bit differently.
I think you addressed the second half of that question about what changes that might do to both the timeline and the capacity. I'd like to double back on the supply issue. You kind of stated what you currently have, what you have on order. Are there any, to date, do we know of any issues at all with the availability of the vaccine, the consistency of manufacturing, and the supply? How has that been tracking in this first essentially month of vaccine availability?
What I can say for Beaufort Memorial, when we've asked for it, we've gotten it, and most recently we've doubled our order, and it looks like we're going to get it. Because before we opened it up to 70 plus, we were getting, we were ordering, about 1,000 every week. We were getting it. There's always, especially in today's world, rumor, conjecture, misinformation. And so there have been rumors out there that Some hospitals have not gotten it. I've tried to confirm that with DHEC. They've said no, hospitals have gotten what they've wanted. I have heard that here recently, maybe hospitals who've ordered larger quantities maybe didn't get the entire order, which is a little concerning. So you ordered 5,000, they gave you 2,500. Now, again, that could be because they ordered 5,000, but when you look in the VAMs, they only have 2,000 visits scheduled. And as such, they're going to deliver kind of what that delta is between what you have currently in inventory and what you have scheduled, and then probably an additional amount for walk-ins, et cetera. They're not going to give you, I think, based on supply, triple what they think that you're going to vaccinate. I think they're going to be careful in delivering what is needed to each location across the nation, so as to make sure they're meeting demand as it's being scheduled into VAMs, which is why we want to use VAMs, because as we show more and more need through the VAM system, we will be able to prove we need more and more supply. And I just got an update on this call. Actually, I said something to my class. I said, where are we at? So today we vaccinated 1,804 people as of this morning, and right now we have 2,800 visits scheduled over the next 30 days and climbing. So, I mean, the VAM system is working, people are getting scheduled, and it is growing very quickly. And our goal is just to continue to put shots in arms. So right now, to kind of round back, Ian, what I would say is right now, I believe when we order, we're getting it. And that's a good thing.
That's good news. Two quick housekeeping questions that we've already been hit, but I want to make sure we reiterate. First, that email address that was vaccine@bmhsc.org. Is that correct?
That's correct.
So for the folks asking about the email address, vaccine@bmhsc.org. And then the other housekeeping request, the VAMS website, VAMS. Do we know the URL for that to direct people to the proper website for VAMS?
When you get, yep, it's VAMS. So it's vams.cdc.gov.
That's vams.cdc.gov.
I would also say, Ian, another way to contact us, and Courtney McDermott, our Director of Marketing and Public Relations, just texted me. We now have live on our website an active sign-up form. And so essentially it collects the information for us where you don't have to email us. You would go to our website, you would click on the banner for COVID-19. You would then say you would click one of the active links. It's a blue link that says you must register, and it will take you to COVID-19 vaccine registration, and allows you to give us all the information we would require. We would then take that information, we would download it into VAMS either that night or the next day. And then that would be what would generate your email from the CDC VAMS website to start your registration process. So we've made another easy way. Instead of just emailing us, you could just do it into an active sign-up sheet, hit submit, and that will put it in the format that we need in order to get you signed up into the system to start the process.
So that's great. Another straightforward way for anybody to get into the system. Visit bmhsc.org, Beaufort Memorial Hospital sc.org. Again, I'll invite any final questions. If there are any that we haven't addressed, please get those in now, or if you want to unmute yourself, this is your opportunity to do so.
Ian, it's Nicole Bentley. Can you hear me?
Yes, Nicole, go ahead.
So I actually wanted to follow up. The release of the second dose was different than the Defense Production Act. I might be getting very granular. I'm just curious if Dr. Baxley, you've heard anything about the possibility of the Defense Production Act being invoked, speeding up the process, or if that's already built into the current timeline.
I would say that has not reached my level yet. So in my phone calls with,
yeah, I figured it was a DHEC question, but I thought I might ask just in case.
Yep.
Thanks.
I just want to thank Russell for all he is doing for us. You know, I'm getting many emails, obviously, because I'm a council person, about, you know, help me, I can't do this. We're trying to help as many people get registered as possible. Yes, we have discovered that if in fact you don't have a valid email address, you are not going to be registered. So we do have husbands and wives that only have one email address that they're using. That's a problem. We do have some technical difficulties with getting onto the various sites. Spelling of a name may be wrong. Something is wrong in the system, and that's why someone isn't getting an email and somebody else is. So we're trying to work through those problems as best we possibly can.
Councilman, thank you for weighing in, and I am really glad to hear that the interest level is that high, and I know we've got some great strategies to work through those problems that we've heard about on this call. I did just get another question in about registration, even if you're not in the current eligible group. So if you're not in the group 1A or not in group 1B, based on current eligibility, are you still allowed to go in and register, or are you advised at this time to stay out of the VAM system?
Right now, you're advised to not register, and VAMS really doesn't have a front door so for you to go self-register. Right now, it is still directed either by employer or by hospital or health system. And so that's why we've been sending the links directly from Beaufort Memorial or working directly with the employers, because it has to be uploaded by either the vaccination center, your email into the VAM system, and or it has to be uploaded by your employer. And so right now, even if you wanted to, there's really no front door access to do so. And we're not encouraging, say, 1Cs to give us their information. We just don't have the capacity to do that. We have been proactively reaching out to some of the employers, such as the 1Bs, because what we can do and what we have done is we ask the employers to send us a spreadsheet with all the information we need, and then we take that spreadsheet, we upload it to VAMS, and then send it out to all the employees who are interested in the COVID-19 vaccine. For example, we've already worked with the Beaufort County School District. We have a very, very, very large Excel spreadsheet that when 1B is called, we already have the school district, the teachers, the dietary workers, the maintenance department, whoever that may be, we already have their information. And when 1B is then called, which includes that population, we will already be able to download that into VAMS and send them their registration email. So we have done our best to be as proactive as possible to go ahead and start collecting information on 1B people, at least through their employer, so we can get that out the way. And those that are not 1Bs, or those that are 1Bs without an employer, let's say the 65 and over, it cuts down on the emails, the traffic, and to the call center and everything else. And we can address the individuals that way versus having, those that maybe have an employer they can work with, having them call as well. So we are trying to divide and conquer the different populations as it opens up by phase.
Russell, for independent schools not affiliated with Beaufort County School District, can they work directly with the team at Beaufort Memorial to get pre-registered for 1B?
Absolutely. So you can use that same email address at vaccine@bmhsc.org. And what would be helpful as the 1B employers come up is if you just put together an Excel spreadsheet with first and last name, the position of the person, and their email address, to verify that they work for that employer, and then we will get them uploaded. It is much faster that way for your employees. And again, it cuts down on our traffic on the departments we set up when the individuals are calling trying to get registered. So it definitely helps. So please, yes, if you're in that 1B category, go ahead and get us a list, send it to that email address, and we will hold on to it and get it uploaded as soon as 1B is called.
Great. So to recap, if you're out there and you're in group 1A and you're eligible now based on age or based on profession, you've probably gone through your employer. If not, please try to self-serve. Start with the Beaufort Memorial website. Try to go through that route. trying to help the hospital and vaccine team get as much information as they can, as efficiently as possible. That's the most efficient way. If not, there are email and call center options for you to get some help. If you're in 1B and you're an employer, get your list together to expedite the distribution of information when 1B is called. If you're not in 1A and you're not an employer with a lot of folks in 1B, hold tight, be patient, and get ready. So as soon as you're called, we can get in line. Is that about right?
It's about right. And if you have any questions, again, feel free to email that vaccine@BMH, even if it's just general questions. We are working through each of those emails every day, and we will get to you.
Terrific.
Russell, can you go over one last time? When you're on the Beaufort Memorial website, you said there's a way for individuals to register right now?
Yep. So if you go to our homepage,
Yep.
and there is a banner at the top of our homepage, and it will say COVID. It will say learn about shots. So Beaufort Memorial will offer the vaccinations. It says learn about shots. You click on that link.
Huh.
And then it says, and then right there at vaccine information in a green bar, it says 70 or older ? Register to receive the COVID-19 vaccine.
Okay, because I'm on the website right now and all I get is the 11621 new visitor restrictions in place. I don't see anything else.
So I've just done a quick screen share from the homepage. Learn about shots. I think we're going right here, correct, Russell?
That's correct.
70 or older. And this is the form we're talking about, correct?
Yep, that's the active form that you enter your information and it will fill it in. You hit submit and it will send us in the format we need so we can get you uploaded.
Okay, I'll try and do it again. Thanks.
Great, so that's off the homepage. In the top banner, learn about shots. Under vaccine information, this first big button, 70 or older, should pull up your form.
Ian, can we, I think the URL right there, can we maybe share that on the URL with everybody? That way they can have it and that will take you straight to it.
Of course. I just put that in the chat for everybody who's still on the line. You can click it right there. All right. I think we have exhausted our, as I see from Courtney, we have a user-friendly URL. I believe she's going to post that as well. There we go. BeaufortMemorial.org/vaccine is your user-friendly, easy URL, BeaufortMemorial.org/vaccine. All right, I'll again thank everybody who was on the call today for joining. I'd ask you, please be an ambassador for this information in your networks, at your workplace, with your friends, in your church group, in your family. Please help navigate people to the right information. Please help share the right information. The future of our economy and our region's health and the health of employers in this region really is contingent on us getting this, this disease under control. It's in our power. The end's in sight. There's light at the end of the tunnel. And I'm projecting that we're going to have a really successful 2021 throughout the second half of the year. As we get more and more people vaccinated, more people will be confident engaging in commerce. Workplaces can stay open. Employees can stay on the job. All of this is important for the health of our community, not just our personal health, but our economic health as well. I'd like to thank Chairman Passman and County Council, as well as City Council and the Town of Port Royal Council for continuing to encourage mask wearing. I know it's a pain. I know I don't love wearing them any more than anybody else does, but we've got to clear that hurdle. We think it's certainly important for businesses here keep people as safe as possible, keep businesses open, and keep employees on the job and employed. And masks are an important part of that strategy. Vaccines are an important part of that strategy. Russell, thank you for your transparency today. Dr. Gambla, thank you for joining as well. And for everybody who was on the call, we appreciate your time. Have a good afternoon.
Thank you, Ian.